Okay, I think we'll get started. A very, very warm welcome to everybody this evening, and thank you for joining us this evening. My name is Ofra Muflahi, and I'm the professional lead here at the Royal College of Nursing for the nursing support workforce. And today we're going to be talking and discussing certainly the contributions of the nursing support workforce through the lens of mental health. As I'm sure many of you will know, that the RCN is a UK-wide membership organisation, but it's great to have people from all over the world. We do have people from all over the world joining us on these sessions. And of course, within the Royal College of Nursing, we welcome the nursing support workforce, and within the Royal College of Nursing, we have elected members in the Nursing Support Worker Committee who represent our membership across the UK. And today we'll be hearing certainly from the History of Nursing Forum and some of the work that they've been doing, really proactive forum in the History of Nursing Forum. We will have opportunities for questions. You can either put them in the chat or raise your hand. But I do have to go through a few housekeeping before we carry on with this evening's session. I'm sure that many of you are familiar with the Zoom, but there's a few things that you might just need to know about before we proceed this evening's event. If you could kindly all go on mute, that really helps the speakers throughout the event. That would really help the speakers moving forward. And if you can also turn off your video by clicking on the camera symbol, which is on the bottom of the screen on the left-hand side, because that really does improve the connection on Zoom, and it reduces the bandwidth. Thank you for that. If you are having trouble with Zoom, the best thing to do is to leave the event and then restart Zoom, and our team behind the scenes will let you back in and you can rejoin. This is a public forum, so everybody can see your comments, and of course the session today is being recorded. But if you wanted to have a private message with the host, then there is the ability to do that also. And of course there will be an opportunity to have further discussions after our speakers have presented. You can raise your hand, of course, and we'll see that and we'll bring you in. But I think without further ado, I really want to crack on and introduce our fantastic speaker. And I think it's really important to open the dialogue from two of the wonderful speakers that we have today. So I'm going to introduce our first speaker, who is Professor Claire Chatterton. And Claire is a visiting professor at the University of Chester and the University of Chichester. Her research interests lie in the history of nursing and mental health care, and she is the past chair of the Royal College of Nursing History of Nursing Society, and she's a fellow of the Royal Historical Society and of the Royal College of Nursing. So I'll hand over to Claire, and thank you very much for joining us again tonight.
Thank you, Ofra. Thank you for your kind introduction. Thank you to the Royal College of Nursing for organising and hosting this event. And also thank you to all of you for coming. It's great to see so many people are joining us in this Zoom meeting. And lovely to meet you, Angela, and look forward to hearing about your experiences later. I've had a few technical problems in terms of sharing my slides, so apologies that I'll have to say next slide, but at least it means that you're able to see them properly. And hopefully that'll help me talk you through this potted history of the development of mental health nursing, and particularly thinking about the concept of nursing support workers, of registered nurses. What do we mean by these terms, and where have they come from, and how have they developed? So first of all, can I have the next slide, please? I often use this quote. It's by a vice president of the USA back in 1952, a man called Adlai Stevenson, and he said, "We can chart our future clearly and wisely only when we know the path which has led to the present." And I think that's what has always given me an interest in history and an interest in the history of nursing. I'm a general nurse, I'm a mental health nurse, and I've always been fascinated by what came before me, what has informed the kind of nursing work that I've experienced. And in my 40-year career as a nurse, all the changes I've seen and what's coming in the future. So I hope you find, as I say, this historical overview interesting. Next slide, please. So this is a couple of relatively recent pictures, and in them you'll see me in my last job, which was working for the Open University. And at various times I've worked as a nursing practice tutor, so I supported student nurses who were doing the Open University's pre-registration. At the time it was a diploma in nursing program, and you'll see me there with a group of my students who were qualifying who were graduating at the Bridgewater Hall in Manchester. Oh, there's some strange squiggles appearing on the screen. I'm not sure where they've come from, but it's not me, I don't think. Um, so I don't know whether somebody's pressing something, but anyway, just to point that out. The reason I showed that is because these pre-registration diploma in nursing students were all nursing support workers in mental health. And they had the opportunity to do their training and education and gain their diploma in nursing through our nursing scheme, which meant that their employers basically continued to employ them as support workers, but also enabled them to do a part-time training. And at the end, they qualified as mental health nurses. And so that was a very proud day for all of us, because I've been with them on their 4.5-year journey. But also it's quite interesting seeing them make that role transition from being a support worker to a mental health nurse, a registered mental health nurse. So let's go back in time now. So on to the next slide. And just to say that there's some good books out there about the history of mental health nursing. When I first started being interested in mental health nursing history, which was when I was doing my own training back in the early 1990s, um, there was very little out there for anybody that wanted to find out about mental health nursing history. And the first book is the one on the right, which came out in 1993 by Peter Nolan, A History of Mental Health Nursing. And later, the one in the middle has been written by him together with Neil McRae. That's a longer and more detailed and obviously more up to date history. And then on the left, there's a book that, oh, can I go back again, please? Thanks. A book on mental health nursing, which I contributed to, that was edited by Amber Say and Pamela Dale. And there's also quite a lot of good articles as well. So if you are interested and you'd like to find out more, I would recommend any of these to you. And also, as I say, there's lots of articles to be found in a library search as well. Okay, so on to the next slide, please. So I'm going back in time now into very early history of what we would now call mental health care. It's debatable whether it was seen as care at the time, whether it was seen as containment. But the early beginnings of mental health nursing can be found way back in time. And I often start with this concept of the keepers. That was an early name for people that we would now describe as mental health workers. And their idea was that they kept people in places of confinement, people who were deemed to be what we would now call have mental health problems, that were mentally ill, mentally disordered. And one of the things I want to say as well is that the terminology that is used has changed very much through time. And sometimes words that were used in history, such as lunatic, mental hospital, can seem really offensive to a modern day audience, but I'm using them within their historical context. This scene is known as Scene from a Madhouse by William Hogarth, the famous engraver painter. And that was really what the early places were called. They were known as madhouses, and the people that were employed were known as keepers. Next slide, please. But there was a change that came in the 19th century when the terminology changed to that of an attendant. Now, attendance was the term that was used for what we would now call mental health nursing staff throughout really the 19th century, what we call in the UK the Victorian period. And the reason why those numbers of staff increased dramatically was that the amount of institutional provision increased dramatically. Because in the early times, when I was talking about keepers, there were a few institutions. The most famous, of course, is the Bethlehem, or where we get the word Bedlam from. There were some private asylums that were set up. There were also lots of little madhouses that were often run on a profit making basis and caused a huge amount of concern and public inquiries and scandals. So there was a movement for what was known as lunacy reform. Surely there's got to be better places where people with these issues can be cared for. And also after the 1834 Poor Law Amendment Act, when the UK saw the growth of workhouses to house people that were deemed to be poor, then there was also a real concern that a lot of those people that were in workhouses were themselves suffering from some kind of mental health disorder or problem. So the movement for kind of lunacy reform led to this famous Act of Parliament in 1845, which mandated the building of what were known then as lunatic asylums for the poor, for paupers, in every county of England. So the idea was that they came under the similar system of ratepayers. So they were effectively state run, and these asylums were built across the UK. And my research is primarily focused on England, but obviously this was a thing that was happening across what we now call the four nations of the UK. And apologies to colleagues from the other nations, because most of my examples I know are from the English setting, which is where I've done my research. And this picture is of Colney Hatch Asylum, which was one of the large asylums that was within London. So the 1845 Lunatic Asylums Act led to a vast amount of building. Already some institutions had been built, but now it was mandatory. And of course, all of these institutions needed staff to work in them. And the people that were recruited to work in them were known as attendants. So why had the term keeper changed into attendant? Well, next slide, please. Well, that was part of a movement that is often described as moral management. And that was a new approach to mental disorder. And it aimed to replace what had been used, which was generally physical restraint of patients, with what was seen as non-physical treatment, such as keeping people occupied, giving them activities, giving them work, providing them with good food, providing them with fresh air, and lots of exercise. And there were a lot of people involved in this movement. Some of the early psychiatrists, for example, were, but it was particularly pioneered by a Quaker known as William Tuke at the Retreat in York, which was a private asylum, a charitable asylum, which still, of course, exists today. So moral management was driving that agenda in terms of mental health care. And the idea of an attendant was that they would attend on the patients and care for them. So a very different concept to the concept of a keeper who was kind of containing people, I would argue. Next slide, please. So when we think about the early attendants, there are some very early photographs, not many from the Victorian period, more at the turn of the century and what we might now call the Edwardian period in the UK. But this is one of my favourite photographs. This is actually from the hospital where I trained, which was Littlemore Hospital in Oxford. And here we can see some very early asylum attendants to be photographed from the 1900s. And one of the things that I think is striking, I think there are several things that are striking. One is what they're wearing. The women were dressed very much as Victorian or Edwardian domestic servants. And you'll see that the male staff are in these very military type uniforms, looking a little bit, they're not quite such big caps in Oxford, but if you look at some of the other asylum photographs, they're almost like gendarmes in Paris with these quite high hats, with chains and with whistles. And the two men that you can see on either side of the photograph in waistcoats are the two medical officers that worked in the asylum, the medical superintendent who is in charge and his assistant. And then at the front, you can see the kind of senior nursing staff, one with a little dog on her knee on the right hand side. But I think one of the other things that's very striking about this photograph is the number of men in the photograph. Because, of course, if we contrast the development of mental health nursing in the UK with the development of general or adult nursing, it's a very, very different divide on sex terms. So, whereas in photographs of this period of adult or general nurses or those that worked with sick children, we would see all females. Whereas in mental health and what was quite blurry at the time, but began to develop as learning disability nursing. At the time, there was a lot of kind of blurring between the two roles and between the types of patients as well. Often they were all nursed together. We see there that it's a kind of 50-50 divide. And that means that there's a very different, I think, feeling to the development of mental health nursing from other branches or fields of nursing, as we refer to them in the UK. And the development of those fields of nursing, as we call them now, has been very different. And it's still possible to pick up a book of the history of nursing and find that nobody mentions people that work in mental health and learning disability. They've actually been quite invisible. And that's why I think it's good to see these photographs and as a reminder of those people that were doing early nursing work in a mental health setting. So next slide, please. And one of the reasons why there were so many men working in this field of nursing as well as women was what many historians have called the Great Divide. Because these huge asylums that were built in the Victorian period, and they grew as the time progressed as well, building on further wings, and then there was a whole new wave of asylum building at the beginning of the 20th century, in the 1900s, because there were so many patients that they needed more and more institutional provision. And that's another story, really, I guess, about why that happened. And it's contentious and debatable. But what that meant was that more and more nursing staff needed to be recruited. But because of the way that the hospitals were built, and again, this is an aerial view of Littlemore Hospital at Oxford. So that looks very familiar to me because that's what it was like when I was training there, is that there was a male side and a female side. And so staff that were recruited to look after men were male, and staff that were recruited to look after females were female. And these were strictly divided on sex lines, arguably in some hospitals until the 1960s. Next slide, please. And these early nursing staff had often an enormous rule book or manual of duties that basically guided their work. So in 1914, this is the manual of duties for the County of Essex asylums. And so by then they had several. And this is Rule 223, which says quite a lot about the nature of nursing work, arguably. But you'll see there, and this is very, very common in every rule book that I've looked at for different English asylums. The male and female patients shall be kept in separate wards, and no male attendant, servant, or patient shall be allowed into the female wards, nor any female to enter the male wards. Any attendant or servant transgressing this rule, unless a satisfactory explanation is given to the medical superintendent, the doctor in charge, shall be immediately suspended. And this was sometimes a sacking offence. Although, interestingly, oral histories of nursing staff will often talk about romances between staff. So the Great Divide was sometimes breached. But as I say, it's very interesting. And I think that's why there's been this large number of men in mental health nursing, and that continues to this day. So next slide, please. So thinking about these attendants, well, arguably in the whole of the Victorian period, there was no distinction made between registered, unregistered staff. The concept of registration hadn't come in. There was no concept made between qualified or unqualified staff. All the staff that worked or did what we would now call nursing work, the attendants, worked together. There was a hierarchy in that you could be promoted. To a charge nurse, for example, or to a senior nurse in charge. But generally, it was what we might call a flattened hierarchy. And when attendants were recruited, and often they were recruited from the local community, they were left to learn on the job. It was a classic learn on the job idea. You went along, you followed somebody else who had maybe been doing the job for longer. Usually in charge of the ward, there was a charge nurse, and you would pick up what to do from them. And that was basically it in terms of any training. And often attendants were recruited, men were often recruited for their strength. So sometimes they came in as from farm labouring, for example. They were usually working class, both men and women. Sometimes they were ex-army, and obviously, again, they were often strong. They were used to discipline. They were used to following orders. And female nurses were often recruited from the class of women that would have gone into domestic service. And one of the attractions of working in an asylum was that your accommodation was provided, your food was provided, but also, of course, you lived in just the same way that domestic servants would live in with the families usually that they were working. But the difference, obviously, was often these institutions were remote. So they could be cut off really from arguably local communities. And sometimes attendants would come and go. So in farming communities, for example, they might leave and go and work on the harvest and then come back again. But there was always this, I would say, this dissonance between the realities of recruiting people into a role that was generally poorly paid, that was generally very hard, very long working days. Attendants were expected to sleep on the wards. Didn't have separate nursing homes. They were expected to do shift after shift after shift with no days off, very little annual leave, very little time off, and under a very, very strict disciplinary code. I gave you an example of a rule book. Well, there were lots and lots and lots and lots of rules. And the medical superintendents were extremely powerful. So there was an aberration of those rules, you could be summarily dismissed, sent down the drive, as it was called, that long drive from the institution, and with no references. So it was a very controlling environment, arguably, both for the staff as well as obviously for the patients. But medical superintendents, who themselves had formed a professional organisation, because psychiatry itself was developing as a profession. And from 1841, there was a professional association for what we would now call psychiatrists. From 1865, that was known as the Medical Psychological Association, the MPA. And I'll refer to that later. It's now the Royal College of Psychiatrists. So it's got a long history. They often, at their conferences and in their professional journals, they wrote about how they wanted to get a better class of attendant. They wanted them to be better educated. And you'll see here, this is one medical superintendent, Dr. Clouston, who wanted intelligent staff who had self-control, sense of duty, good at observation, vigour of mind, as he called it, adaptability, tact and temper, kindness of heart, and a physique and health that was strong. But actually, I've written about this in the book I showed earlier on. There's I think, a real disconnect between wanting all these things and then saying, well, actually, well, there isn't much money to pay you. It's brutal. It's a hard job. And so it seems like this theme of who should be doing the work and the reality of people that were recruited to do the work was a constant theme. And in the meantime, of course, as I say, these staff were not receiving any training except on the job training from their colleagues. And some of the psychiatrists were also trying to give lectures to staff, but there were very few of them in these large institutions as well. But there were the beginnings of lectures from medical staff to nursing staff in terms of what the psychiatrists felt the nursing staff should know. So, as I say, that is, the beginnings, I would argue, of mental health nursing from the keeper into the attendant. So, on to my next slide, please. So, I think an important landmark in the history of mental health nursing education is 1885, when this book, which some people on the call may remember, it became known as the Red Handbook for obvious reasons. And its official title was the Handbook for the Instruction of Attendants on the Insane. And it went through many editions, and it was last actually issued in 1978. So it had a really long history. And sometimes when I've given talks like this, and that's my copy of the Red Handbook. I've shown it to people who said, yes, I had one and I remember it. A green handbook eventually evolved for those who worked with people with learning disability. But the red handbook is really important. And why is it important? Well, it's important because it was the first attempt to write a handbook about what was deemed to be the knowledge that mental health nursing staff attendants needed. Now, that was the view of psychiatrists. It was written by doctors, and it was what they thought nursing staff should know. And it's interesting to look at the iterations of this handbook. Obviously, it changed its title to reflect differing views about mental health. And it's interesting to see that gradually nurses began to write in this handbook. First of all, the odd chapter, and then later on, by the end, it was predominantly it was written by nurses. But in the beginning, it was, as I say, it was arguably Mick Carpenter, who's written a lot on the history of unionisation and in mental health, says it could be seen as a sort of paternal innovation by doctors, or a patriarchal innovation by doctors, to say this is what we want you to know. But I think it's interesting because it's the first attempt to really write it down. There had been some earlier books, but this was really a kind of a national scheme by a well-known publisher, Balliol, Tyndall and Cox. So 1885, I think, is a seminal moment, but it also has to be remembered that this was a time in the UK where primary education had become mandatory, but arguably there were still sections of the population whose literacy was very poor. So what we don't know is how many nurses actually were able to buy the book and how many owned it. It certainly sold well in the first 20 years of its publication. But as I say, I think it's important because arguably it's the first national textbook for mental health nurses. Next slide, please. And then, having produced this handbook, the Medico Psychological Association then decided that they would institute a training scheme. And that got going in 1891. And the idea was that nurses or attendants, I should say, within an institution would be put forward by training for training, and this would be at the behest of the medical superintendents. So it didn't happen in every asylum. Now, the MPA's reach was across the whole of Great Britain and the whole of Ireland at that point. Um, so it depended on the enthusiasm of the medical superintendent whether they put forward staff to take this course. But for those who did, they did 3 months on probation, and then they spent 2 years training, predominantly on the job, but they did attend lectures. And at the end, they had to pass a written and a practical exam. And if they were successful, they received a certificate, such as the one on the left, and they also received a medal, such as the one on the right. And this, I think, again, is really important because it's the first national training scheme for nurses. General nurses at the time had training, but it was done in a very individual way by individual hospitals. So arguably, there wasn't a standardization of training in the same way that the Medico Psychological Association tried to do. So I think this scheme is really important. And as I say, it's the beginnings. But arguably, it was still quite basic training. And also, one of the biggest problems was that the staff that did the training, that got the certificate and then got the medal, didn't necessarily get any more money at the end of it. Or if they did, it was a very small amount of extra money. And that caused a great deal of discontent. And in a way, quite rightly, you can imagine how you'd feel if you've done all this extra work, get your medal, get your certificate, and then effectively you don't really feel that you've got an advantage from what you've done. So can I just have another slide, please? Thank you. So again, interesting, going back to this slide from Littlemore from the early 1900s, you can see there that lots of the staff are wearing medals, both men and women. And I know from lots of time spent in the archives in Oxfordshire that the medical superintendent at Littlemore was an enthusiastic member of the MPA and an enthusiastic proponent of the training scheme. So as I say, you can see there those staff with their medals. Next slide, please. One of the things to say as well is that towards the end of the 20th century, sorry, the 19th century, the terminology was beginning to change. So in some hospitals, they were starting to call their female staff nurses. So this is a picture from Claybury Asylum in Woodford in Essex. And there in 1893, you can see some of the female nursing staff, but they were being known as nurses, whereas the male staff were known still as attendants. So the terminology is beginning to change in this period. Next slide, please. But actually, the discontent, I think that many mental health nursing workers felt about their working conditions, about this training scheme that kind of offered and then didn't really deliver in terms of promotion or in terms of pay, led to the formation of the first trade union for nurses, known initially as the National Asylum Workers Union in 1910. And this was famously founded in a pub in Manchester, not far from where I live, by a group of male attendants who were increasingly frustrated by as I say, this dissonance between the paucity of their living conditions and wages and the strict discipline that they were sort of enduring, and the rhetoric of we want to have better trained and more intelligent and staff. So the National Asylum Workers Union, you can see there on the right, as I say, images of male and female staff, nursing staff, and on the left, you can see their badge. And nurses, as you know, we do love our badges. The National Asylum Workers Union went through various iterations and joined with other unions, became known as COSY after the Second World War, then UP, and then we now know it as Unison. So a bit like the Royal College of Psychiatrists, it's got a long history of various iterations. But the National Asylum Workers Union is really interesting because it obviously was there to fight for its members. And we'll see later that that can mean that there was all sorts of debates going on in this whole idea of what constitutes mental health nursing work. So next slide, please. And as I'm racing through the history of mental health nursing here, so I'm sorry if I'm skating over some things, but hopefully it'll give you a good flavour of where mental health nursing has come from. So another important landmark in the history of nursing, of course, is the 1919 Nurses Registration Act, which, well, I should say acts, because there was one for England and Wales, there was one for Scotland, and there was one for Ireland. And they brought in the idea of nurses having to be registered. Now, it was controversial about whether people who worked in asylums counted as nurses. And there's a very famous quote here from Ethel Bedford Fenwick, who's known as one of the chief proponents of nurses registration, when in 1896 she wrote, "Everyone will agree that no person can be considered trained who has only worked in hospitals and asylums for the insane. Considering the class of person known as male attendants, one can hardly believe that their admission will tend to raise the status of the organisation." So it was controversial. Were these people nurses? Should they be allowed onto the register? And actually, a long battle took place, not just to bring in nurse registration in the UK, but also to bring in mental health workers as part of that registration. And interestingly, the Medico Psychological Association fought strong and hard for the staff that they worked with them in the asylums to be recognised. So eventually, next slide, please. When the Nurses Registration Acts came in, the general nursing councils, which again were set up for England and Wales, for Scotland, and for Ireland, were given three tasks. And one was to compile a syllabus of instruction, one was to compile a syllabus of subjects for examinations, and one was to establish a register of what was called qualified nurses. Next slide, please. So there were 5 parts to the register as it was in 1919. And you'll see there in red that mental health nurses were actually on what was then known as a supplementary part of the register. There was the general part, what we now call adults general nurses. And then there were these supplementary parts, which caused a great deal of unhappiness because it felt a bit like they were sort of secondary or second best. But there was a part for male nurses, there was a part for nurses trained in the nursing care of persons suffering from mental diseases, as it was called then, and ultimately those separated out into mental health and learning disability. There was a supplementary part for nurses trained in the nursing of sick children, and what was called any other prescribed part, and that came to include what was known as fever nursing as well. And obviously, this has gone through great changes over the years. The General Nursing Council morphed into the UKCC, the United Kingdom. Oh, my mind's gone blank. But the UKCC replaced it, and then later on, the Nursing and Midwifery Council. But the General Nursing Council was very influential in the early development of all fields of nursing. Next slide, please. And I just wanted to show you these two people because when the General Nursing Council started, it had a caretaker council, 25 members, and of those, only one was a mental health nurse. Oh, thank you. Somebody's just said Central Council. Thank you. And that was Tom Christian, who you'll see. Sorry, I'm just reading that. That's Robert Donaldson. Sorry, but the first person was Tom Christian, and then in 1923 the General Nursing Council started to have an elected council, and 2 places were made available for mental nurses, as they were known. And these were the first 2 elected members. So Robert Donaldson, representing male mental nurses, as they were called, and Maud Visa at the top, representing female mental nurses. And Maud Visa in particular wrote with great passion about what a difficult time she had trying to represent mental nurses when they were surrounded by general and adult nurses. And again, there's a whole story that I've written about to that. But next slide, please. What was interesting, though, about this was that the General Nursing Council thought and expected to take over training and examining and maintaining a register of mental nurses. That was the official title that they were given after the Nurses Registration Act. I myself am a registered mental nurse, an RMN, and it comes from those early days. But what was interesting was that the MPA, and from 1926 they were known as the Royal Medico Psychological Association, didn't give up their training scheme. And so for the next 30 years, the two of them ran parallel training schemes. And I've written an article about this, which I've just given you the headline, Caught in the Middle. And I think it's fascinating that for 30 years, there were 2 rival training schemes for mental health nurses. The vast majority of nurses opted to carry on with the psychiatrist training scheme, the RMPA scheme, but some went for the General Nursing Council scheme. And it was a very kind of bitter rivalry that went on between the two. And it's interesting that the two coexisted for so long. And generally, the union supported the Medico-Psychological Association scheme because it was felt that it was more reasonable, it was more practical. There were all kinds of reasons why, which I explore in more detail in the article. Thank you. I've just seen the comment from Russell Ashmore, and it's nice to see Russell on the call because he's written a lot about mental health nursing development as well. But it is a really interesting one, and I do wonder to what extent that helped the whole sort of professionalization of nursing, the whole training of nursing when all of this was going on. But eventually, in 1951, the Medico-Psychological, or the RMPA as they were by then, sort of backed down. And when they ended their training scheme, they had actually issued 50,000 certificates of qualification to mental health nurses. So it had been a very significant training scheme. Next slide, please. But while all of this debate was going on about training, arguably many staff were not being given the opportunity to do any training, and their working conditions and their pay remained very poor. And there were a large number of strikes that went on amongst mental health institutions. And the most famous of these was what became known as the Battle of the Radcliffe Asylum in 1922, which I've also written about because it's an extraordinary story. This was a mental health institution near Nottingham where the staff were the mental health nursing staff were expected to take a cut in wages at the same time as their working week was increased. This was a post First World War One austerity measure, but quite rightly, I think, the nurses resisted this. There was a sit-in strike. There were scenes of terrible violence and struggle, and eventually they were ejected from the hospital and sacked. And after that, the union's power was quite significantly diminished. But I think it's important to remember that we can paint a very sort of positive view of training and of people having the opportunities to become trained nurses as they were known in the period. But the reality was that often there was very little distinction made between those who had trained and those who hadn't. And their working conditions were still very poor, as of course they were poor. And I realize I'm concentrating on nurses here, but I do acknowledge, that they were very poor for patients too. So next slide, please. So here's another slide from Littlemore Hospital in Oxford. I love these pictures, partly because on the left, the nurses at the front look so happy, and these are student nurses. And then at the back, very stern-looking sister in charge of them. And by then, of course, nurses were beginning to live in nurses' homes. And there was the beginnings of the ideas of schools of nursing where student nurses could be trained, and an idea of someone being a student nurse as opposed to being a staff nurse or a charge nurse. And on the right, the reason I've shown this is because the nurses that have got those black bands on their arms, that wasn't to do with someone dying. That was to do with the fact that they passed their preliminary exam, and that showed that they had a certain amount of experience and training. But again, as I say, in the 1920s and 30s, this was a very, very blurry boundary. And my grandma trained in Sedgefield at what was the Durham County Asylum. And it was, again, she spoke to me about how the fact that she did some training, but again, it was very, very blurred in terms of who did what and what different roles were. So on to the next slide, please. So lots of different changes were coming in. The 1930 Mental Treatment Act, which introduced the concept of the voluntary patient, the role of physical treatments, the National Health Service coming in 1948, and then later another legislation act in 1959. On to the next slide, please. and the growth of physical treatments, which arguably changed the nursing role and arguably led to the need for more training. And you can see there on the left, male nurses in their white coats, and on the right, female nurses, again in very traditional nurses' uniforms. Next slide, please. And then the National Health Service is really interesting because this came in the UK in 1948, and you can see there Aneurin Bevan, the Minister of Health. But at the time, there were real worries about how the NHS was going to function because they didn't have enough nurses. And here are some quotes. "The shortage of nurses is a national disaster," said the Lancet. "The situation is without exception desperate." And well into the 50s, what was known as mental and mental deficiency nursing was seen as the weakest link in the chain of nursing because it was so difficult to recruit and retain nurses to work in mental health services for many of the reasons that I've already explained. Next slide, please. So in the 1950s, you can see there on the right, twice as many nurses are needed. Huge efforts were made to recruit staff. Lots of posters trying to make mental health nursing seem more attractive. There were exhibitions, there was lots of publicity, lots of therapeutic optimism about new things that were happening in these large institutions. Next slide, please. And a lot of my research has been about this period, the first 20 years of the NHS. You know, I've looked at, well, why was it such a problem to recruit? Why couldn't they retain staff? Why was it that there was huge what were called attrition rates for student nurses? 70–80% of those recruited left. And I don't have time, obviously, tonight to go into the detail of that. But what I was interested in is, well, what were the strategies that they used to try and improve that? And I looked at the whole thing about advertising and the dissonance between maybe the rhetoric and the reality and the image. I looked at education and training schemes, and I also looked at a huge amount of recruitment from overseas. And obviously, overseas nurses have played an incredibly important role in the development of mental health nursing. You can see there a little logo from the period. Psychiatric nursing was the kind of new term that was being used, the worthwhile career. But the strategy that caused the most hoo-ha was the concept of what was known in the period as dilution. So looking at the skill mix, how many trained nurses do we need? Should we have a kind of a different grade? Should we have nursing assistants? Should we have enrolled nurses? They'd got enrolled nurses in general nursing. That had come in 1943. Were they needed in mental health nursing? Next slide, please. Now, this caused, as I say, huge debate. The unions fought very, very strongly against the idea of having different grades of staff. There was all sorts of language used, like the idea of subordinate staff, you know, which seems uncomfortable today when we would like to work in a collegiate way. But there had been a big move towards changing the skill mix and bringing in what we would now call support workers or nursing assistants. And finally, in 1955, both in general nursing and in other fields of nursing, the concept of a nursing assistant was recognised by the Whitley Council, who set the pay for nurses. And so, arguably, then I would say a divide began to emerge between what were perceived to be support staff and what were perceived to be trained staff. And also, enrolled nursing came in the 1960s in mental health and learning disability nursing. Initially, people were able to join the role of nurses by experience, and then there was a 2-year training and a 2-year syllabus administered by the General Nursing Council. And it was often known as different portals. So Abel Smith, an early historian of nursing, talks about the third portal, the idea of having a nursing assistant or a nursing auxiliary in all fields of nursing. So in the 1960s, I would argue that mental health care was in a real state of flux. Enoch Powell, the then Minister of Health, had made a famous water tower speech where he'd anticipated the eventual closure of the large institutions and the beginnings of community care. There was a whole movement of academics and writers and psychiatrists themselves who were challenging what was happening in mental health care. And there was a whole series of scandals about terrible patient care. But still, recruitment efforts continued. Come and work as a psychiatric nurse with very attractive images of nurses. And the title psychiatric nurse, I think, was firmly embedded by the 1960s, and also the term nursing assistant. But yet, archival material shows that actually there was a huge amount of blurring between the roles. And because it was so difficult to recruit and retain trained nurses, or registered nurses as we now call them, then often their work was done by nursing assistants, sometimes to the point that they were left in charge of wards. Next slide, please. And here's a picture from Claybury Hospital, again in Essex, in the 1960s. So a contrast to that earlier picture. There you can see one of the male staff and a variety of female nursing staff from a variety of different backgrounds. And again, I was very lucky to interview some of the nurses from the 1960s as part of my research. But to finish off, I just want to go on to the next slide, please, and just briefly bring us up to date. And I'm conscious that this is really fast. But again, there's been all kinds of changes to mental health nursing work. The closure of the large institutions, community care, the 1983 Mental Health Act, which is still with us with amendments, Project 2000 coming in nursing, which introduced the idea of mental health being a branch of nursing, and it's being taught in universities and no longer in schools of nursing in individual hospitals. In the 1990s, the introduction of the assistant practitioner role to work alongside healthcare assistants, support workers, and registered nurses in mental health. In 2011, and this came in at different points in the UK, but the idea that nursing would now be a degree level only, and that the field of mental health nursing would be retained, because often there's been a lot of debate about whether we should have separate training schemes or registrations. We're very different from many other countries in the way that we have these separate paths through nursing work. And of course, in 2016, and this was only in England, nursing associates coming in to what, and I quote the NMC here, to bridge the gap between unregulated healthcare assistants and registered nurses. And we'll be hearing about Angela's experiences in a minute. So last slide. So I just want to say, I've been a registered nurse now for 40 years, and I've worked alongside nursing auxiliaries, as they were called, nursing assistants, support workers. And this is a picture from the 1990s in Littlemore Hospital in Oxford. You can probably tell by the spider plants and institutional seating. And I'm there with two of my colleagues. I was a sister at the time. On the left is a staff nurse, and on the right is she was called, I think, a nursing auxiliary at the time, support worker. And they were fabulous colleagues, and we worked very much as a team. So I'd like to pay tribute really to all the support workers that I've worked with who do such a valuable role in mental health care. And my last slide is just to say, thank you very much for listening. And I'm sorry it was a whistle-stop tour, but hopefully it gave you a good overview of mental health nursing development and the development of the support worker. Thank you.
Thank you so much, Claire. I've certainly learnt a lot this evening. Really insightful presentation, and really understanding that how mental health nursing has evolved over time. I could sit and listen to that presentation again. I really could. It was fascinating. But I really would like to introduce Angela, who is a nursing associate. I met Angela a couple of years ago, and she spoke so passionately about her journey as a nursing associate. And Angela is a nursing associate in the Mental Health Trust in London at Springfield Hospital. So I'm going to hand over to Angela so she can speak to the audience. But thank you so much, Claire, and I'll do some feedback after Angela. Over to you, Angela. Thank you.
Hello, my name's Angela Hawkins. I'm a nursing associate and I currently work on an adult eating disorders ward. I started my career in mental health in September 2014 when I joined the eating disorders ward as a healthcare assistant. Prior to my career in mental health, I spent 22 years in electronics before moving into care work, where I worked with adults with learning disabilities. I learned a great deal working in the care home, but I didn't really enjoy the sleep-in duties. So when I was ready to move on, I wasn't sure where my next challenge would come from, but I was drawn to an advert advertising healthcare assistant roles at Springfield Hospital in Tooting. Because I have some lived experience of an eating disorder, I thought that I would be able to use my experience to support the patients on the wards. In reality, however, the challenges me and my colleagues face on a day-to-day basis are much deeper and more extreme than what I have experienced. There are times, however, in conversation with patients when I can draw on my experience and have an understanding of the emotional battles they are coping with. But also my experience can be a bit of a burden, as I can be inclined to be a bit too flexible with boundaries. But that's also a confidence thing, as I sometimes struggle to be assertive when the patients are challenging me. And I think the nature of eating disorders is that patients strive for perfection and they can't always take knockbacks, they can't always accept no. And so there can be a bit of a battle sometimes, and it's can be difficult to hold the boundaries in those situations. The thing that I find very challenging also is the level of self-harm our patients can exhibit. We have days when one or two patients may attempt to tie ligatures, and we have some patients who self-harm by cutting or headbanging. Another aspect that can be very challenging is when patients choose to restrict on their diet intake. With an informal patient, we have no power to enforce nutrition, but with a patient who is being nursed under Section 3 of the Mental Health Act, we can enforce nutrition via a nasal gastric tube. This procedure can be even more challenging if the patient won't accept the nasal gastric feed voluntarily, and then we have to physically restrain the patient to provide the required nutrition. It is done as it's a life-saving procedure, but it doesn't take away the fact that it can take its toll both emotionally and physically on the staff who are involved in those procedures. I think the aspect I love most about my job is when I'm working with a patient who may be struggling with the treatment program, but is nonetheless really trying to do their best to stick with it and make some positive changes that will progress them to discharge. Our ward is a very challenging and busy environment, and it can be hard to find the time to spend with patients. But if I'm able to check in with someone, even for a brief moment, to find out what their needs are for the day or what they may be struggling with at that point in time, and then if I can communicate that to the wider multidisciplinary team and get a positive outcome for the patient, that can be very rewarding. I think it's hard to describe a typical day because the nature of mental health means that things can change in an instant, and we have to be ready to react to crisis as it arises. As a nursing associate, I can coordinate a shift, but I can't be the nurse in charge. If I'm working with a permanent nurse, I'm often asked to do the medication rounds. The doctors, dietitian, occupational therapists, and the other members of the MDT, they'll arrive on the ward at 9 o'clock, and I can support the nurses by giving a handover to these members of the MDT. During the day, I may be asked to sit in the dining room and eat a meal with the patients to model good eating behaviour, and that can be challenging at times. Or I may be asked to support the nurses in doing the nasal gastric feeds. If tasks and time allows, then I can arrange to meet my key clients for key works. We also have times when we have a 9 to 5 shift, and that allows me to attend review meetings and CPAs, and I can also update patient care plans and risk assessments with the outcomes that are agreed upon. The other members of the multidisciplinary team run groups and also do individual work with patients. So the occupational therapist may do meal preparation and escort the patients out into the community for snacks and meals. The dietitian offers patients appointments for meal planning and advises of increases needed for weight gain. The social worker supports patients with housing and benefit advice. So overall, we have a good team that works well together to progress patient care. I did my nursing associate training in 2017 and was the first cohort for Springfield, and also we were the first cohort to train at St George's Hospital. I think the thing I enjoyed most about the training was doing the placements, and I went to community nurses. I did a couple of placements at St George's Hospital. I went to the Star and Garter home in Surbiton, so the placement experience was lovely. I enjoyed that. I think in the history talk, the thing that struck me was the change in wording from, to think that people use the word insane when people in the olden days, and we didn't really understand mental health. But I think now the caring community is so much better. The fear of mental health is lessened, and people born now have much better health outcomes. We look at the physical side and the mental health side of the patients. And I'm also glad that we don't have to wear those scary uniforms in mental health as well. So I think that was what I had got prepared for tonight. But I hope that gives you an idea of some of the things that I do in my role.
Thank you so much, Angela. Like I said, I met Angela a few years ago, and absolutely fascinating journey that you've taken, and you bring a real passion and commitment to the work that you do. So thank you so much. I think we're going to open we're going to open to the audience for some questions, but while you're all still thinking about what questions you're going to post in the chat, or you can raise your hand, I just wanted to do a bit of summing up really around what I heard today, and how nursing has changed, and really insightful presentation by yourself, Claire, and really understanding the history, because I think often history can be forgotten, and it's really important to keep hold of the past, going back in time and what mental health support meant, the language that was used. And I think Angela alluded to that, and how people were referred to as keepers, and an appreciation of some of the positive changes that have taken place in mental health nursing. And I really liked your photographs, because they say a picture says 1,000 words, and they absolutely did. And the photographs that you shared really spoke volumes. But I was really interested to also hear about how it was a much flatter structure, and you know, people were taught on the job, so to speak, and that was really interesting to hear that. And I also almost glanced over the list of what makes a good attendant, and there was one particular one that really stood out for me, which was kindness of the heart, which I thought was really interesting. And you know, I think, you know, is it compassion, or you know, it really spoke volumes to me when I saw that. And then you talked about the Red Book and the language within it. It was just amazing, the history around how nursing has evolved. And I did have a little chuckle when you said that the nursing union was created in a pub in Manchester, and some of, you know, some of where union power and influence, you know, really started out. But and just to finish, really, in terms of just fascinating history, really. But you know, some of the things that were emerging around workforce pressures and shortage of nurses is not dissimilar to what we hear now. But I'll end on one thing that I saw on one of your slides, which is, I think, the 1960 slide, which said, surely the most rewarding job in the world, and it was in the corner of one of the slides, and it is absolutely you know, the most rewarding job in the world. And Angela, I think absolutely for me, the passion and the commitment and the work that you do when you bring your personal and your professional experience to the space is I'm sure fully welcomed and appreciated by your team. And I really want to thank you for your personal reflections and sharing, you know, with such honesty, your own journey and your insights, and most importantly your perseverance and your patience. And I'm absolutely sure that you are a huge asset to your team, Angela, so thank you so much. It's been an absolutely brilliant session. And I can't see any more questions, but I'd just like to extend my thanks again to Claire and to Angela for a fantastic evening, a vibrant evening of rich discussions, and articulating so eloquently the journey of mental health nursing, from certainly through the lens of a registered nurse, but also through the lens of a support worker that works in mental health, and for sharing your personal and your professional experiences in this space. So thank you from me. And on that note, I bid you all a fantastic and restful evening, and hopefully you'll join us for our next History of Nursing session. Bye bye, everyone.